talk to you all today about some of the patient considerations in systemic therapy. So I'll highlight some of the main classes of medications that we use, but then also from a patient perspective, some of the toxicities of those medications and kind of how we manage those. So just in general, just know that whenever you're coming to clinic, we do consider all patient factors when deciding on your treatment regimen. Comorbidities are super important, so especially with some of the classes of medications we use, it can affect the heart, especially hypertension. It is one main side effect of one of the medications we use, so we do take that into consideration. And usually work closely with your other healthcare providers to make sure that this is managed very well. Liver disease can also impact things because a lot of the drugs we use are metabolized through the liver, so we'll always be checking baseline labs before starting you on any systemic therapy to make sure that your liver, your kidney function is good to start, and we'll keep a close eye on that throughout treatment. Autoimmune disorders are super important to let us know about just because, as I believe my colleague Judy talked about earlier, immunotherapy is one of the mainstays of treatment, and I'll kind of highlight some of the side effects of that as well. And obviously we consider age and performance status as well as patient preferences. Some people have the goal of having great quality of life and they don't care as much about length of life, where other patients care more about days, and so we do take that into consideration of how a patient's doing and including your perspective as well when helping decide on treatment regimens. So this is the kind of the class that my colleague talked about earlier, the immunotherapy. PD-1 blockade is kind of one of the main classes of immunotherapy, and I thought that this was a little fun cartoon to kind of show you in a more fun approach, basically how these drugs work. But basically, cancer cells like to block our immune system from working the way that it should. So if you think about the blue cells, the T cell from our immune system, and the pink cells, the cancer cell trying to attack it. Basically, there's a PD-1 receptor on the T cell that the pink cell or the cancer cell likes to block. And by blocking that, it actually blocks your body's immune response to fighting off those cancer cells. And it can let the cancer cells go rampant and throughout the body. So when we use medications like the PD-1 inhibitors, like pembrolizumab or nivolumab, they actually block this binding of that cancer cell to the T cell. So think of it almost like as a little hard hat on the T cell, so on your immune cell. And that basically prevents that cancer cell from blocking the T cell from working the way that it should. So you can kind of see there at the end, the T cell is actually killing off that cancer cell because it's having that ability to because of that blockade. But although we do ramp up the immune system to fight off the cancer cells, this does kind of release the brakes on the immune system. So there is the chance of toxicities, right? So if we let that immune system go too crazy, it can affect any normal healthy cell as well. So a lot of times I think people have the assumption that, oh, immunotherapy is safe, it doesn't have as many side effects, but we do have to make sure that we're monitoring patients really closely because any healthy cell in the body can potentially be affected. It's important to let other healthcare providers know that you're on these types of medications just because I'll talk about in a couple of slides, but these effects can last for a long time even after stopping immunotherapy. And some of the side effects can be potentially fatal and serious. Although a lot of patients do tolerate therapy very well, it's still important to kind of be aware of these risks. It's important if you're going to a local ER that's not part of a cancer center that you let them know that you're on immunotherapy because they might not be as familiar with triaging these types of side effects. A lot of times it's a diagnosis of exclusion, so we kind of have to rule out other things to see if it is the immunotherapy causing this. And we do use a lot of combined treatment, so we might use immunotherapy with another class of medication, so a lot of times we might have to hold both of your treatments until we figure out which one is causing it. It's definitely important that all patients and caregivers are educated on this, and I'll kind of show a resource that's good to have, like a little wallet card that you can carry in your wallet to say that you're on this type of treatment later on. And this just kind of shows you, so technically, like I mentioned, any organ in the body can be affected by immunotherapy. And obviously it's a super important balance, right? We want that anti-tumor effect, but we don't want to make your normal healthy cells angry. Any organ, like I said, can be affected, but I'll kind of highlight some of the side effects we see more commonly. So including the skin, so think about your skin as one of your biggest organs in your body. Rash tends to be one of the more common things that we see. I'll talk about that in the next couple slides. I'll also talk a little bit about the GI tract and the risk of colitis. So all these itises are kind of the things that we're worrying about because basically immunotherapy can cause that inflammation in the body. The other important thing to point out is that these drugs do stay in the body for a really long time. So as a pharmacist, we always look at half-lives of the drug. So how long does it take that drug to leave your body? Usually it takes anywhere from 4 to 5 half-lives for the majority of a drug to be out of your body. So for example, I have the half-life of nivolumab, which is one of the commonly used immunotherapy drugs. It's 25 days. So if you think about that, even 4 half-lives, that's 100 days before a majority of the drug's out of your body, and you can even see effects long after that. So that's why even when we stop therapy, we still have to be considering this for toxicity purposes. And then, like I mentioned, we'll kind of go through some of the more common side effects that we see. Skin rash, I always tell patients if you're going to pick one side effect of immunotherapy you might get, skin rash is probably the most common thing we see. Up to 30% of patients might get this toxicity. And these are just some kind of common tips and tricks of what to do to help manage that. So in general, I'm always telling patients to make sure you keep your skin well moisturized. Itchiness can also be a side effect of immunotherapy, so if you already have dry skin, that can kind of predispose you to that. I usually recommend any fragrance-free lotion or cream. You want to avoid any like strong perfumes or colognes because that can irritate the skin, even like detergents and things like that. Avoiding tight-fitting clothes because that can also irritate the skin. Making sure to avoid long heat exposure, so that's going to be difficult, especially in Florida, but making sure that you're protecting your skin when you're outside. Definitely either wearing like UV shirts, sunscreen of at least SPF 30. That includes lip too, so making sure that you have like a lip balm that's at least SPF 30. If or at any point you develop any rashes or itching, it's important to let your healthcare provider know because we'll kind of help manage that. And sometimes before even starting this class of medications, your provider might want you to pick up some over-the-counter antihistamine cream or even a steroid cream just to have on hand in case this does happen. The next toxicity that we'll talk about is gastrointestinal toxicity. And so the big thing that happens with immunotherapy is something called colitis. So think about it as inflammation in your GI tract. And this just shows you we do use combined immunotherapy. So obviously when we're using combined immunotherapy, the rates are going to be a little bit higher with different classes of the medications. And one other important thing to point out is that these toxicities don't happen right away. So it's not like you get your infusion, you go home the next day and you're going to have side effects. Typical timing of onset specifically for this one is usually about 6 weeks after treatment. So sometimes when you're coming for your second or third infusion, you might start to develop these toxicities. But like I mentioned before, they can happen way later on. So even 107 weeks into treatment, you could be on treatment for 2 years and all of a sudden have toxicities down the road. Things that you need to report to your provider are basically any changes in bowel habits, especially if you're having abdominal pain, blood or mucus in the stool. And I'll mention diarrhea management a little bit later on when I talk about some of the oral options for kidney cancer. Now, pulmonary toxicity is going to be a little bit less common, but it's one of those like less common but more severe side effects I always like to tell patients about. Basically, there's a higher incidence in lung cancer patients, but we do still see it in kidney cancer. Usually when we have combined therapy, it's a little bit higher of a rate of this, like kind of like with all the other side effects. And this one tends to happen a little bit further out into treatment. So a few months into treatment, you can start to see this one happen. The big thing to watch out for is any shortness of breath or coughing. And this is much different than when you're sick. It's usually like a dry, non-productive cough that patients can get. But it's always better to call your provider if you're not sure. And then usually for this, we'll probably have you go to your closer urgent care if you're far from Moffitt or come to here. And this is another thing where it's good to have the name of the medication you're on your medication list, so the providers at a local hospital would know that you're on immunotherapy because they'll triage your side effects a little bit differently. Like I mentioned, it's super important for patients to be aware and be their own advocate as well as their caregivers. So this is a little card that I usually try to hand out to our immunotherapy patients. It's very helpful to kind of have in your pocket just to show any providers at a local hospital with your name, your cancer diagnosis. Usually I'll put what medication you're on and when you're starting it, as well as the main provider that you're seeing and then the hospital's clinic number. And then also just being educated on the side effects that you need to report. So like I mentioned, the shortness of breath is one of the more urgent things that usually I recommend patients go to the ER for. But you can always call our patient care hotline if you are getting treatment, and the nurses will kind of walk you through what to do. And like I mentioned, this can happen even up to a year after finishing treatment. So it's super important even after you finish treatment. So we do adjuvant treatment sometimes, which means we do it after surgery for 1 year. Even after you finish that year of treatment, you might need to report this to healthcare providers for up to a year after that. So now that we've kind of talked about immunotherapy, I know you guys have had your fill of that between me and my colleague today. We'll talk about some of the other classes of medications. Sometimes in the advanced setting, we'll use combinations with immunotherapy and with this class of medications. These are the vascular endothelial growth factor receptors. And I just listed the most common ones we use in clinic, including the axitinib, cabozantinib, lenvatinib, and tivoxantin. But basically think about this. Cancer cells like to recruit your blood vessels to get nutrients, and kind of how this drug works is it kind of cuts off that blood supply. So if you can see over here, if a cancer cell is under vasoconstriction, it actually leads to like the cancer cells dying off, which is what this drug ends up doing. Where when they're in vasodilation, you have normal angiogenesis, so normal growth of the blood vessels. Those cancer cells are able to recruit blood vessels and get nutrients and continue to grow and expand. The downside is when we cause vasoconstriction, we cause some of the side effects of these medications. So things like high blood pressure, like I talked about earlier, We can cause things like hurting the kidneys with proteinuria, hand-foot syndrome where the hands and feet are affected, bleeding or bruising risk. But it's kind of one of those risk versus benefit, just like with the immunotherapy. We have to cause that vasoconstriction to kill off the cancer cells and kind of manage the toxicities as well. So it's definitely that fine balance again. So nausea is one of the side effects we can sometimes see with this medication. And these are just kind of the simpler things that you can do at home to kind of help treat these side effects. It's definitely important, especially if you are getting nauseous, to drink plenty of fluids and staying hydrated. A lot of times trying to drink a lot of fluids at once can kind of be upsetting to the stomach, so usually kind of sipping on small fluids throughout the day. I also usually recommend breaking up meals, so rather than eating like 1 or 2 big meals throughout the day, try and do 5 or 6 little meals or snacks throughout the day. That can kind of help keep the stomach settled. You don't want anything greasy, spicy, or fatty, because obviously that can upset the stomach. And then kind of paying attention to if you are exercising and you're feeling good, making sure not to do it immediately after eating, because obviously that will make you feel sick. And then avoid lying down. I know sometimes our patients can be really tired and fatigued, but you want to try and sit up for at least 2 hours after you're eating, just to help kind of make sure you're digesting everything and you're not getting any of that nausea or like acid reflux. Certain odors can be triggers to patients, so definitely letting like other people in your household know that certain smells bother you, that kind of thing. And then also, if you are experiencing nausea or vomiting, it's important to contact your provider, because there's things we can do to manage it. We can often give you a nausea medication that you can take before this class of medications, and that can kind of help you take it every day, and that way you don't have to deal with the nausea. I always tell patients it's better to stay ahead of the nausea. Don't wait until you actually get sick. If you're having that queasy feeling, definitely reach out to us. And then the other common side effect we see with this class of medication is mouth sores. So a big role that I have with patients is making sure that they're doing all the preventative things. So how can we prevent you from getting these types of mouth sores? Good oral hygiene is really at the basis of this. If you keep your mouth clean and free of bacteria, it's going to make you less likely to have this issue. I also usually recommend using like a baking soda and salt mouth rinse. And I always tell patients it doesn't have to be an exact recipe, like a pinch of baking soda, a pinch of salt, about 8 ounces of like warm water, and gargle and swish and spit with that a couple times a day. It'll also kind of help protect your mouth and prevent this from happening. Super important to avoid any like alcohol-containing mouth rinses. So like Listerine and stuff like that can be very astringent to the mouth. There are different saliva substitutes that you can get over the counter, like biotin and things like that, that can also be super helpful. Just because if you tend to have a drier mouth, it'll make you more prone to these type of mouth sores. And sometimes your gums might be more sensitive too when you're brushing your teeth, so you want to be real gentle. Use a soft toothbrush as well. And then if you do actually get mouth sores, it's important to contact us, because there are prescriptions we can send in that kind of have numbing agents to help treat these. And especially we want to make sure it's not interfering with your ability to eat or drink. Now we kind of talked about diarrhea a little bit when we talked about colitis earlier. And so this is where it can get tricky with some of the overlapping side effects. Because immunotherapy can cause diarrhea, but so can some of these oral agents. And so a lot of times if you're experiencing these symptoms, we might have to hold both drugs until we figure out which one's causing it. But obviously making sure you're staying hydrated with plenty of fluid. I usually also recommend adding in some electrolytes like Gatorade or Pedialyte if you are having diarrhea. Once again, the small frequent meals. I usually tell patients to avoid high fiber. I know fiber is usually supposed to be so good for you, but it can be really bloating and cause really upset stomach, especially if you are having diarrhea. So we usually recommend over-the-counter loperamide or Imodium, and we'll kind of walk you through how to take that if you do need to start this class of medications. I also usually recommend anything that can cause gas or bloating, so like broccoli and things like that. And then a lot of patients have, like, dairy can cause a lot of upset for some patients. So I would say if you are experiencing diarrhea, that's one of the first things to take out. You can kind of go back to that bland diet. I was always taught like the brat diet, you know, banana, rice, applesauce, toast, bland, simple things to kind of help keep food digested. Then if you are having more than 4 loose stools a day, that's kind of the trigger to call your provider. Just because at that point you might be getting dehydrated, we want to make sure you're optimizing over-the-counter medications appropriately. And if those aren't working, then that's when we might want to have you come into the hospital and get checked out. And then like I mentioned, hand-foot syndrome is another side effect we see with this class of medication. It's basically a rash on the palms of your hands or the soles of your feet. And friction can make this worse. And so you can almost get like peeling or callousing of the skin. Sometimes sensitivity, like almost like a pins and needles feeling can happen. It's important to stay really well moisturized and kind of exfoliating any dry skin off. There's a couple different creams we usually recommend, but Utterly Smooth Cream is a really great cream that has urea in it, and that can actually help prevent some of that peeling or cracking. But in general, creams are usually better than lotions. They're thicker, they can kind of help keep the hands and feet moisturized. And once again, sticking with that fragrance-free, you don't want any fragrances or irritating things in them. Again, avoiding tight-fitting shoes or socks. You want really loose, comfortable shoes, but you don't want to walk around barefoot either because that can also irritate your skin. So think about wearing socks or slippers around your house and looser-fitting shoes when you're out. Definitely avoiding long, hot showers or hot exposure to the sun. If you are outside, make sure you're wearing sunscreen yet again. And then definitely making sure you're cushioning your hands and feet. So if you're gardening or doing anything like that, I usually recommend you're wearing gloves to help kind of protect your hands. And then if you do actually develop blisters, we usually want to know about them sooner rather than later. Some of these oral drugs can stay in your system for a really long time, so it's always better to call us earlier than wait until they actually get to be open blisters or sores, because then it does take a little while for those side effects to reverse. And then, like I mentioned, this class of drugs does cause that vasoconstriction, so by doing that, it can also increase the risk of bleeding or bruising. So any new or unusual bleeding or bruising is something super important to report. I usually say bleeding that doesn't stop on its own is going to be the emergency. So for example, if you have a nosebleed, you're applying pressure, it's not stopping within 5 minutes, that's something that you probably need to go to the hospital for. Trying to be careful avoiding any cuts or scrapes. One thing to avoid too is if you are shaving and things like that, I usually recommend an electric razor just because it'll help decrease the risk of cutting yourself. The next class of drugs that we use is the mTOR inhibitors. So once again, one of the more common ones that we use is everolimus, but kind of similar to the last class of drugs, it works on the cell growth and proliferation. It basically blocks a certain protein that leads to cell growth and proliferation. So when we block that protein, it prevents that cell growth and proliferation, therefore killing off the cancer cells. This one has a little bit of a different toxicity profile, but some of the things are overlapping. So if we do use it with the former class, sometimes we can see an increased risk of mouth sores, diarrhea. This one also does cause skin rash, much more photosensitivity. One of the more unique side effects with this is the fluid retention, and I'll kind of talk about what to watch out for with that on the next slide. So fluid retention is basically, you want to avoid standing for long periods of time. If you are getting fluid retention, definitely report it to us, especially if it's only on one side, because we have to worry about other things like blood clots. But in general, kind of trying to minimize extra salty foods because that can increase the risk of swelling. Once again, avoiding those tight-fitting clothes and shoes because that can make it worse. And it's a good idea to kind of keep a little weight log. So I always tell patients to keep a weight log, a blood pressure log. That way we kind of know when you come into clinic if anything's changing. And if you are gaining more than 5 pounds within a week period, that's something important to report to your healthcare provider. Or obviously if you're developing any symptoms like shortness of breath or anything like that, it's super important to tell us about. And the last class of drugs I'll touch on are the hypoxia-inducible factors. This is a newer class of medications, but belzutifan is the main drug that we have in this class. And basically that hypoxia-inducible factor promotes adaptation to hypoxia. So what that means is the cells can function better with hypoxia. So, which means when they have low oxygen levels. So if we block that transcription factor, once again, it cuts down that cell proliferation, that new growth of blood vessels, and also tumor growth. So they all kind of have the same input, trying to kill off those cancer cells by decreasing proliferation, but they all kind of target different pathways to do that, which is why even though you fail one medication, we do have other options because the other drugs might work even though you've tried one of the other ones. The main side effect we see with this one is fatigue. So I'll kind of talk about how to manage that on the next slide. So it is super important to report any excessive fatigue to your providers, especially with this class of medications. But in general, just fatigue from any of these medications, making sure you're alternating periods of rest with activity. If you are tired, give yourself a break, take a nap. Regular exercise can actually help sometimes with the oxygenation of the blood, so trying to keep up with walking and things like that if you do have the energy for it. Make sure you're getting enough sleep and that you're not having alcohol or caffeine too close to bedtime. And then if you are having issues, definitely talking to your providers, or if you're having emotional issues too that are leading to the fatigue, stress, depression, we do have social workers available to kind of help with some of these issues and kind of give you resources for that as well. And then kind of knowing when you do feel good throughout the day. So if you know, I always feel good by noontime, like try and plan your activities around that time, you kind of optimize your day and make you feel a little bit better. And this is just an overview, kind of showing you the difference. Like I mentioned, the immunotherapy drugs tend to cause all the itises, so all the inflammation in the body, whether it be the skin, the lungs, the colon. We can see all those things with immunotherapy, where with the oral drugs that we use, we tend to see more of like the high blood pressure, the hand-foot syndrome, the mouth sores, more of those different systemic side effects. But like I mentioned, there are overlapping side effects, so a lot of times it's important to report to your healthcare provider so we can figure out if we have to hold both drugs, hold one drug, just depending on what regimen that you're on.